us what's going on.
So I've had TMJ pretty much as long as I can remember. As a teenager, I've seen several dentists, orthos. I've seen a jaw specialist. I've always had the popping and the clenching. No one was ever able to really give me any relief. I've had braces twice. None of that's helped. I had teeth pulled. Nothing. But Derek's been treating me for a while now, and it's definitely something that I've never experienced before. And it's the only thing that I've found that gives me any kind of relief.
Yeah, we've worked on this a couple of times. I kind of bounce back and forth. And so, what are you feeling now? What's
Well,
been
the
going
last
on
2
the last
days,
couple of days?
I find myself, and I'm not a clincher, but I've realized I am catching myself behind the mask, clenching, and just wearing the mask behind my ears, like it's very, very tight. Yes.
Some of that stuff. Are you getting headaches?
No, not really. That was a question that everybody seems to ask. I've never really had headaches from the jaw pain.
Yeah.
It's
That's
just
nice. It's like the trigeminal nerve goes to the same part of it, goes to the same nucleus in the brain as the upper neck. So a lot of people who get jaw pain get headaches and get cervicogenic dizziness. Tender right there?
very tender.
Both sides?
This side more than this side.
Yeah.
It's a little.
Yeah, definitely tighter up there. Look up for me. What do you
And I
feel when you
noticed-
do that?
Well, I was saying 2 days ago I did a workout, and I was like, as soon as I did, I was like, I know I'm going to be hurt. My neck's going to kill me.
Does
And
that
I
bother
just
you
went
doing
like
that?
this,
Yeah.
and it looked like it was off, just looking, but I was never able to put my head back and easily put it back forward without pretty much forcing. Like if I get my hair done, anything where I'm laying back, it's like I just can't like easily.
You feel like it's off like that?
It just feels like the my vertebrae are so compressed. Like once I get here,
when you do that.
it's like I just can't easily put my neck straight.
So, look up. So for you, like we definitely have some shifting going on in there. So we'll loosen some of that stuff up and start getting some of that moving. Turn your head to the left for me. And the right. Tighter on one side or the other.
Left, the right side's tighter. Sorry.
Whenever you turn to the right.
No, it's like I feel my shoulder want to come forward.
So when you turn to the left, you feel it on the right.
That's what I meant. Yes.
Yeah. See, can we take this off?
Yeah.
Stretch. So whenever she looks up, we can kind of see that a lot of the muscles on this side are trying to like almost pull her over to that side. We can just kind of, before we kind of dive in, start loosening some of that stuff up in there. Tender. That one kind of feel like it wants to radiate up into the head some.
It's like instantly burning.
Look up. Back there.
Oh, here.
Yeah. Look up. Good. To the left. Good. To the left. Try that again. Going down. Again. That move again. Again. There it goes. Good. Definitely more level. So where this was all further down before, starting to kind of get back to a level jaw. So a lot of the pressure across the jaw actually comes from people who have an imbalance in the upper neck, because if we're off here, then all of the muscles that pull up into the jaw on this side are going to kind of pull and compress there. So when they open, they get off axis in the jaw. So if we're treating the jaw without treating the neck, we're not getting into all of the issues that can cause problems up there.
Exactly why I've never had any relief, because they've always looked at just the jaw.
Yeah. Do that one open. Let's do a little bit of this one. and close. So for her, when she opens, this side's staying tight, what we were just talking about. So as she opens, this side won't slide forward, and so over here, it pops because this one's continuing to move forward, and then she catches back up on this side. So we'll loosen up a couple of things and then come back and see if we can. Turn to the left. And on her is that when we tighten down on this side, the upper vertebrae in the neck almost kind of like pivots out, so it's like it's the balance of the head slides off, and so we get to where like she's her upper vertebrae is really prominent on this side. Like as soon as I wrap off of her skull, you've run into that vertebrae, meaning it's all the way pulled off to that left side, and then there's a big hole over here. Like I can't even find it whenever I start sticking my finger in there. That's a big difference to you. I feel quite a bit different.
A lot different.
On it, nothing there.
Nothing. Oh yeah.
So that's so open again. And close. How's that feel?
Better.
Better than it was.
Nuts.
No pop.
None.
That's helpful. Let's shift to the neck and shoulder real quick, and we're gonna come back to that upper vertebrae. Raise the arms up. Reach up towards the ceiling. And come on down. What do you feel with that? Does that bother you at all?
I don't have any pain.
Feels a little tight on the side when you do it.
Just in this area. That feels like super hard.
So
muscle.
turn your head, turn to the left again.
Like right there.
And you feel that here whenever that happens?
Yes.
Okay. Everybody's favorite one. We're going to take some tension off of that.
I was like, oh gosh, so soft.
A lot of people get, so when that shoulder gets pulled forward and all this is tight, all that shifts up here where these muscles are kind of trying to pull you back into kind of a neutral position. And so all this locks up because of our position. So you're going to reach across and then you're going to reach out. And we'll do that with this hand. So reach to your left knee. You know you did disco before.
Oh, like this.
Like that, yep. You got it.
And continuously do that or no?
You will continue to do that. Just a second. Come back across. Back up. Cross. Back up. Cross. Up. Back across. Up. Cross. Up. Cross. Up. Almost there. Almost there. There it goes. Two more. Reach through. Back down. Up. Squeeze your elbow back. What'd you feel there?
Twitch.
Just releases.
So twitch. Yes.
Take that over there. Come back. And turn. Turn. Okay. And again. Good. And again. Turn. Very good. Raise the arms up. Getting up there better. What's that feel like? You still feel that in the back or no? Gone. Nice. Hands down. A little bit. Let's do the same one on this side. Sassy hip. And squeeze back. So a lot of times whenever we're working on a lot of these things, like people will pick out like we were saying, that one part where, oh, your jaw's kind of pulled here. And we loosen all that stuff up, but your chest and your shoulder are still tight. And the STM and scalenes are still pulling you down here, and your neck's still in a bad position. So we're still compressing the nerves. Trigeminal nerve comes right over. So we did that one part, but there's no way it's gonna stick. Like there's no way it's gonna last, because all of those other factors are still there to re-irritate that problem. Deep breath in. Let it go.
First visit with Derek, he did explain to me that a lot of my issues with my neck was connected to the pain I was having in my jaw. So he worked some magic with me. He adjusted my neck for the first time and did some dry needling.
Deep breath in. Let it go. So for Kristin, we feel like a lot back here. I think some of that's clenching, and some of that's been like being forward and kind of having that tuck. She gets tight, and a lot of these attachment sites behind the jaw. So it's hard for that jaw, the joint to glide correctly. Okay, open. Right before it starts to pop, pause. Okay, you feel that right there. So there's these deep muscles in the jaw called the pterygoids that very tight, and that's what she's got compressing her over here. Very hard muscles to get to, but with this it can be really helpful. Tension right there and turn. Very good. Open. Close. Is that hard? You feel like it still kind of wants to shift over on that side? Do that again. Bit. Do it again. Close. You felt that over here? Mm-hmm. Okay, go back. Open again. Look up a touch. Push your jaw forward. do it a little further. Stick it forward again. Jaw is such like this, like, you know, it's this 3D like lateral and rotational thing. So we really want it to be in that kind of perfect position with the perfect amount of tension on both sides. So for something we use a lot, I think it's mistreated. Open. Jaw issues we see like stress and anxiety and depression all climb along with other like autoimmune issues because your body's just constantly dealing with all this other stuff.
I can definitely put my hand and say, as I've gotten older, I realized it does. It definitely.
It's definitely something we've started like looking at when people are like, yeah, you know, I'm dealing with, you know, I feel stress. Like, start kind of checking the jaw, make sure we're aligned, in the upper neck as well. Breaths in through the nose. There you go. I feel better. Mm-hmm. Smooth. Yeah.
Derek saw me and related it to the neck, and it helped tremendously. So PT is where it's at.